how do we know your patient is deteriorating? Let's go over some common signs of deterioration because these are going to be your first red flags that something might be going on with your patient that we need to keep a closer eye on. These are in no particular order, but the first one is anxiety or feelings of doom. If your patient starts saying things to you like, I don't feel well, I'm really concerned, something's going on, something's wrong, I feel like I'm gonna die, take those things very, very seriously. Could it be anxiety? Absolutely. Best case scenario, your patient's anxious. But worst case scenario, your patient has something really serious going on. Next thing are any changes in vital signs that one are not expected for this patient, or two are a change from their normal trend or what we would anticipate for them. This may look like your patient is getting more tachycardic, or maybe now they're in AFib or AFib RVR, and prior they were in a normal sinus rhythm. Your patient may be more tachypnic or have increased work of breathing. You may see an increase in your patient's temperature, or on the flip side, you could also see your patient is not able to maintain their temperature really well. A drop in blood pressure or widening pulse pressure are also some other signs that something's going on with your patient. Your patient's coloring may change. Maybe they're more pale, or maybe they're super diaphoretic, and you're like, you don't look well. Change in mental status is huge. And there are so many reasons for why your patient could have a change in mental status. It could be delirium. It could be medication induced. It could mean that they have sepsis, or maybe they've had a stroke. Maybe they have an increased CO2 level. There's a lot of reasons why your patient may be altered, but nonetheless, anytime your patient has a change in mental status, whether it be cognitively or maybe something physical, like now they can't move their right side very well, or they're having some vision loss on one side, take those things very seriously. And last but certainly not least, this is probably the most important one, is your nursing instinct. If your gut is telling you something is up with this patient, even if you can't quite put a finger on it, my spidey senses are tingling. I'm going to be keeping a close eye on this patient. Maybe I'm going to take initiative and check on them more frequently, or do vital signs more frequently, or look into things just a little bit deeper. Like, what is going on with this patient? Why do I have this feeling that something is not right?